Just a couple drops there. It's about 5 drops. So you see how that one doesn't taste so. Like this one tastes much better. This is the flavored one.
Okay.
Yeah. So split it half and half like that. So I usually tell people to do 5 drops. Let it, swish it in the mouth. Let it absorb.
Yeah.
And you see how it, you taste how potent it is because it doesn't have that oily flavor to it too. Because it's highly purified. And then this one is flavored, sweetened with stevia. Okay, and then just let that absorb. It's much sweeter because it has the stevia in it. So that's the berry. They have a cinnamon flavor too. All right, so that's about done. Yeah. These. Out of the way so we don't have all this clutter.
And what type of needle will you suggest?
I'm going to use the small one. I'm going to give you needle.
Oh, okay.
Oh yeah, I'm going to give you needles to take back with you.
Awesome.
Just an alcohol swab. Don't need anything more than that. All right, is it pretty thawed out now? Yeah. Yeah, pretty much.
It's got a little ball in there.
Yeah, it's not quite thawed yet, but by the time we get this ready, okay. So what we're going to do is you don't really need to put on gloves for yourself. I mean, but just for completeness, I'll put on gloves. This will be in the box. You take it out of the box and you thaw it. Now, all you need to do is you open this up, so it has a little tab there that you lift up. Now the top doesn't come off on purpose, so that if it falls over, it won't roll off the table.
Okay.
Okay. So that's a good thing. Good thing about the design. All right, and that's a rubber stopper there. So we should clean the rubber stopper. And I usually just leave the alcohol pad there. You're going to open up the syringe. Some syringes come with a needle already on it, but this one doesn't have one. But I'm going to give you a very small gauge needle. So I think this is a 25 gauge needle, 1/2 inch.
Oh,
right? All right. So it's very short. So what we're going to do is you're going to pull back to just past the 2, because there's 2.2 mLs of liquid in there. You want to inject the same volume of air into the bottle so you're not pulling against a vacuum. Right? And it makes it easier to draw the medicine out. So hold it pretty firm, and then you just put it right in the middle of the rubber stopper, push it in, and you push the air in. Keep your finger on the thumb, and you angle the needle so that it's down at the bottom there.
Okay.
Right? And watch what happens when I take my thumb away. Because of the air I put in there,
it does it on its
it's
own.
pulling out on its own.
Nice.
Right? So that helps. But you can help it along by just sort of inching it along. So I've got my fingers right here, can you see? And then I just use my thumb to just pull back. That way I can focus on where the tip of the needle is and pull back and get it right down, and get every last little drop.
Oh, yeah.
Right? I mean, of course, I've been doing this for a while, so there's nothing in there.
Oh, nice.
And even when you tap away the bubble, you see that I've gotten just past the number 2.
Okay.
So we've got enough to do the injections. So what we're going to do is we're going to do the injections here, so you can come around and move this chair.
Okay.
So this is where the original primary was, and there was some other spots that showed up that could have been any number of things. We want to, the protocol, we want to inoculate some of these areas. So we don't have to do it, like inject near each one of those, but I would split it up, paying attention to stop at the number 1. So I like to hold it like this. So I hold it I hold it like a cigarette with the thumb there, not here, right here. That gives you pretty good control. You can hold it like a pencil, then you have to switch and do your hand like that, and I find that more gimpy. But it may work when you're doing yourself, because if you're doing yourself, but you can probably do it for her. So you do whatever's more comfortable, like this, and inject, or like this. I like to do this, so it keeps my hand out of the way. I can, so I'm going to clean the skin.
And I don't know if the primary one was...
I'm going to do both between these.
Okay.
It's under the skin. So it's just a little trick is to sort of do a little scratching and then just sort of go in at 45-degree angle under the skin there.
Okay.
And then just inject some there.
Okay.
right? Just put your finger in there, don't want it to leak out, right? No, I got it.
Oh,
I'm just saying,
sorry.
yes, so I do that, right? And then I'm gonna do one of the ones under here, because you gotta remember, when I go underneath, it's gonna go pretty much right underneath that area.
Excuse me.
So just under the skin, and inject a little bit there,
Okay.
okay? And then this one over here.
He used to be a phlebotomist, so he should be.
Oh yeah, pretty straightforward, yeah.
And
And then this one up there, I just saved a little bit, I'm gonna do a little bit there.
It's kind of, that was a gnarly last one.
Yeah. So again, just lift up the skin and make sure I didn't clean that one. I'll just clean it with some alcohol. There we go. Just lift up the skin a little bit and just go right underneath. And then just inject it there. So that goes in. You can actually feel the medicine all underneath there. Right. So that go those. If there's any cancer cells there, they're getting inoculated by the rigvir. And then the next one, if you stand up, we'll do that one. It'll go on the upper outer quadrant. So not right on. Yes, you can stay standing. It'll be a little easier to see on the video. So basically, where the pants line is, I usually say right where the top of the where the tailbone is out to the side.
Okay.
And you don't want to go all the way to the side there. So you stay about halfway. See, it's just a little cushion right here. There's no nerves or anything that you can hit, no blood vessels or anything.
Okay.
So she has the tattoo, which makes it easy. So it's basically right under the wrist of that there. So
That's
right
a good mark.
yeah. So it just goes. This one just goes straight in.
Okay.
And push it down. So you see what I did? I went in and then I moved my thumb, and it makes it easier. I find it easier than trying to do it like that.
Right.
Right?
Okay.
And then you have to gimp around and do stuff like that, or do two-handed. And then the trick is to pull it back out the same way it goes, because if the needle goes in and the needle wiggles around inside there, it's going to cause bruising and damage to the muscle tissue. So straight in, straight out.
Okay.
All right. And I mean, it doesn't even need a
Bandage.
Doesn't need a Band-Aid. You know, and no bleeding or anything.
Wow. Okay.
And then of course you have a sharps container to dispose of everything. You know, wherever most pharmacies will accept a sharps container. So what I usually do is, now I'm going to give you the same bottle that's yours.
Okay.
But I'm going to fill it with just saline, just water at the 2.2 mark, right? And you're going to practice drawing it up, not injecting it.
Right.
Just practice drawing it up a few times, so you can practice it a few times. And and see how, so in case you have any questions tomorrow. So I usually just get a bottle of saline, or a bag of saline. Maybe it's over here. I usually, just a bag of saline just for this purpose. And then I'll get a fresh needle, but get you some of those. So I just refill this up with a little bit of saline, just for the practice of drawing it up. That's where I find most people. I know most people think giving the injection is the hardest part, but getting the medicine out is the first step. That's you're not wasting any of it in the process.
Yeah, it's precious.
Right, exactly. So.
Well, yeah. I mean, I'm glad you're doing this, because I was a phlebotomist for 2 years, but it's like I've been out the game a little bit. But it's like, but this is a totally different situation. So yeah.
Yeah. There we go. So I'll put back in the same volume as what was in the.
Oh yeah.
Okay.
So we can get practice at making sure we get it all out.
Yeah, practice with it. Yeah. Good. So we'll just pretend that these are, brand new packages. No need to be wasteful. You can just, you got everything that you need.
Right.
And a few alcohol swabs to practice with, because you don't want to forget the alcohol swab part.
Right.
Oh yeah, because you got to remember to wipe the top of it. Yeah.
Yeah, just a good idea to do that.
Yeah.
I mean, it's bottled in a sterile facility, so it should be, clean. But I always, I just developed that habit. I just wipe everything with alcohol.
Right.
Just wipe everything.
Yeah.
Yeah. So that can go back in the cabinet next time. All right, so that's pretty much it for the
Okay.
rigvir. It's not that complicated.
No.
You know,